Onassis Foundation. Dublab.
Welcome to the Quarantine Tapes, a daily podcast from Onassis LA and Dublab. Hosted by Paul Holdengräber, this series chronicles shifting paradigms in the era of social distancing.
Hello, could I please speak with Ed Yong?
Hi, speaking.
Hello, Ed. This is Paul Holdengräber calling you from the Quarantine Tapes. Thank you so much for taking the time to speak with us. I'm delighted to add your voice to this project. Tell me, Ed, where do I find you? And if I may ask, how have you been spending these 6 delirious months?
Well, I'm currently in Washington, D.C., where I live. And I've been spending the months, like many other people, sort of holed up in my apartment, but unlike many other people, constantly reporting about the pandemic and trying to make sense of it for the readers of The Atlantic.
Not only the readers of The Atlantic, I mean, I think people are really following what you're saying. And I'm wondering, before we begin to speak about the particulars, do you feel that you're able to make sense of what's happening to us? Because certainly I'm having trouble.
I think it's a huge challenge. The pandemic is a crisis that is huge in scope, that touches on so many different aspects of our lives. And there are lots of different elements of it to try and make sense of. It's not just a scientific problem, a
Right.
virological or epidemiological one. It's also a problem, or it's also a sociological problem, a political problem. And we need to consider all of those facets together to try and understand what is happening. And that's what I've been trying to do in the big pieces that I've been writing.
And when you say sociological, what do you mean? Because for me, the minute you mention sociological, I'm thinking about how truth manifests itself in our society now and the resistance to it.
Look, I'm thinking about all the societal factors that have shaped the course of the pandemic over the last several months. So in the US, it's not just a case, sure, this is about a virus spreading around and infecting people, but it is also about the carceral state. It is also about America's nursing homes and long-term care facilities. It's about the long history of racial and social inequalities that have meant that certain groups of people have been more likely to be infected and killed by the virus than others. So, without accounting for almost every aspect of our society, how we've built it, whom we value and whom we don't, it's impossible to understand what has happened and what needs to happen to help control the pandemic.
And in this way, perhaps this question may be helpful. About a month ago, you were interviewed by someone who also was part of the Quarantine Tapes, Ibram X. Kendi. And he said, through reading Ed's piece, it seems to me that in many ways, the COVID-19 pandemic held up a mirror to America, and Americans did not like what they saw. Can you expand on that? And what are some of the ways in which the pandemic held up a mirror to the United States?
Yeah, I think Ibram is exactly right, and he's written really well about this too. A pandemic exposes every vulnerability in a society that it affects. So in the US, I've already mentioned a couple. If you look at the places that have been most badly hit, you see that clusters have been very large in prisons, and America famously imprisons a larger proportion of its citizens than almost any other country. A large number of cases happened in nursing homes. 40% of deaths took place in nursing homes. Nursing homes have long been understaffed. and poorly resourced. So we wall off the elderly in places where they are often ignored and don't receive the level of care that they need. The COVID-19 pandemic has disproportionately hit Indigenous Americans, Black Americans, Latinx Americans, Pacific Islanders, a lot of Indigenous and minority groups that have long suffered from discriminatory and racist policies that have jeopardized their health, that have disconnected them both geographically and financially from healthcare. And so obviously you have a situation where these groups come into the pandemic with a poorer baseline of health, less access to medical care, poorer medical care when they can access it. And so it is no wonder that they have suffered disproportionately at the hands of this virus. COVID-19 is a disease that might hit anyone and everyone, but it disproportionately falls across the country because of this legacy of bias and inequities that the US has long suffered from, but failed to deal with.
And of course, the big question, which I'm sure you can't answer, and I don't think I could answer, and I don't think anybody can answer, is, will this pandemic be a moment where, after we do find a vaccine, we will deal with it? The hope is that we will, and that we won't go back to what passes for normal, because that in many ways got us into trouble. And I'm sorry to continue in kind of a grim way, but you've written about the grim figures, and particularly you already mentioned them, of nursing homes. You said they are a reflection not just of the greater harms that COVID-19 inflicts upon elderly physiology, but also of the care the elderly receive. Might you comment on that? Because I think not enough commentary is made on that very, very sad situation.
Right. Funding for and resources for nursing homes, are insufficient, and that plays into what has happened during this pandemic. Even in the early months, when it was clear that that COVID-19 kills elderly people to a much greater extent than younger people, nursing homes were not prioritized for testing, for protective equipment. And, it is easy to, what I don't want to do is to lay the blame fully on the nursing homes themselves. I think they are struggling with, these long policies of this long legacy of disinvestment. And a lot of them rely on an immigrant population to staff them, people who often have to work multiple different jobs for low wages, thus connecting people in the nursing homes to other sources of infection elsewhere in the community. A lot of those people were disincentivized from doing that work at all because of 4 years of policies from the Trump administration that have dissuaded even legal immigrants from staying in the US by disconnecting them from sources of social support. So, we enter the pandemic in a situation where nursing homes didn't already, had problems with things like infection control, with adequate staffing. And then those problems only get worse. So this is exactly what we've been talking about, that the pandemic finds inequities and weaknesses and then just tears into them.
In one of your earlier articles about the virus, you addressed possible containment methods that would require increased surveillance. And you write, as South Korea and Singapore demonstrated, such methods clearly work. They undoubtedly raise privacy concerns, but as my colleague Derek Thompson, I imagine he also works at The Atlantic, argues, compared with our present nightmare, strategically sacrificing our privacy might be the best way to protect our freedoms. When I read that, I was wondering, do you really agree with that? And isn't this a truly false and perhaps even dangerous dichotomy?
It's a fair point. And I think that, since then, I think it's become clear that these kinds of contact tracing apps that were very much in discussion in those early months.
Right.
I'm not going to sort of be the savior that fixes everything. I think that even traditional contact tracing can make a huge difference. The problem is that we are not good enough at doing it. So pulling off the basics of just calling people out, finding their contacts, tracking down possible infectious people before they've had a chance to spread the virus. That's all what contact tracing is about. And most of it really just involves calling people. But there aren't enough people to do that job. There's a lot of misinformation, so there's a lot of reticence to answer the phone when contact tracers call. And ultimately, this is not. I think we need to recognize that no single control measure for the pandemic is going to be sufficient on its own, right? Not contact tracing, not testing, not masking. They're all meant to go together. And the problem is that we bounce from one to the next without really rolling them out as a package. Like, there needs to be a coordinated plan that uses all of these measures together to stem the virus. And that's what we've been lacking in the US. And as a result, people sort of bounce from one idea to the next. They look for new solutions, new fixes, when in fact the playbook has been obvious. Now, you could argue, as per the question you've raised, what is the most appropriate way of contact tracing? Is it through these apps? Is it through, more traditional methods? But the fundamentals are the same. And it's just that we haven't succeeded in adequately implementing them.
I'm just so worried, though, because, we take measures in moments which seem dangerous and, in this case, nearly apocalyptic. But then those measures, when the dangers, so to speak, subside, continue. And so the era of surveillance is really one we're living in, and perhaps people will do it now in order to protect others, but those measures may continue afterwards. Does this worry you in some form or fashion?
I mean, honestly, it's a bit of a moot point right now. We're talking about a measure that doesn't have a chance in this country. It's not going to get taken up. It's not going to be the solution. So, we can talk about whether, the possible outcomes of that, but I think it's better to think about the measures that actually have a chance of working in the US to control the virus, like things like rapid testing, like contact tracing, like masking, better solutions for isolating people if they are infectious, like humane ways of quarantining people, giving social support for those who don't have the option to quarantine themselves if they are infectious, because they risk losing their jobs because they earn, low hourly wages. Like I said, this playbook exists, right? And I think we distract ourselves by becoming overly fixated on, technological solutions, on apps, on silver bullets, when in fact this very standard, obvious public health playbook just needs to be enacted properly.
I had occasion to speak to a wonderful Icelandic writer named John, and he said that in Iceland, on television every night, people would be watching television and sort of in concert saying, how can we flatten this curve? And it became nearly a national pastime. And he said the basic playbook there was the government followed the science. And here, it just worries me so much how little of the science we at times follow. And reading your pieces, I was struck by one moment in it, which I'd like to quote back to you. So many problems in a way due to a devaluation, as you say, of expertise. But on January 26, Dr. Fauci said that the virus posed, and you quote him, very, very low risk to the United States. And I'm wondering, why did he say that? And I know you can't be in his head, but do you think that he really believed it? And was it simply that he didn't want Americans in some way to panic?
Look, I can't speak for what Tony Fauci was or was not thinking at that
Of
time.
course.
I will say that, I think that it's fair to say that a lot of people, even people who, have a lot of expertise, were, underplayed or underestimated the risk of the virus in those early days. Now, the question then becomes like, was it fair to do so or not? One of the thinkers who I think has done some of the best work throughout this pandemic, Zeynep Tufekci, points out that a lot of the failures were stemmed from this lack of systemic thinking early on, like recognizing that a fast-spreading, exponentially growing virus can very easily overwhelm us by causing a cascade of failures through the societies that we have built, which are intertwined, where different aspects are intertwined with each other in very complex ways that are very brittle. So we've seen, how a failure to test early on in the US allowed the virus to spread very quickly, which allowed hospitals to be overwhelmed, which created a lack of personal protective equipment, which in turn makes it very difficult to do testing because you need masks to do the tests. Then you get into a problem where the whole world is grasping for the same supplies, which are in short supply because of straining supply chains. And so the whole web just starts to snap. And I think if you're looking at the virus in, say, January, and it's very easy to think, okay, maybe it's just in China, it's not going to arrive over here, and to forget how easily this web of interconnected weaknesses can shatter with just a few problems. And I think that's sort of what happened. Many people would argue that the US was made vulnerable through inexperience, that unlike East Asia or many parts of sub-Saharan Africa, it hadn't been threatened by massive rolling epidemics for over the last couple of decades, with the 2009 swine flu pandemic being a big exception to that. But, it didn't have to deal with raging years-long Ebola epidemics. It was barely touched by SARS and MERS, previous epidemics of coronaviruses. And maybe that is part of the problem, that inexperience combined with America's very traditional sense of exceptionalism meant that the country wasn't ready. Yeah, and then there's also the instinct to not make people panic. I think there is a sense among public health to reassure people, and that instinct often works. We saw like I mentioned, in Ebola in 2014, the US disproportionately fell prey to paranoia and panic, well out of proportion with the actual threat of the disease. And I wonder if that played into some of this instinct to assuage people that in this case, wasn't useful.
And yet, Ed, you've written so interestingly already 2 years ago, you wrote about the fact that this pandemic in some way was predictable and therefore preventable.
Yeah, I think that it was clear that a pandemic was going to happen. Emerging diseases are emerging at a faster clip. Every past administration for the last couple of generations has faced emerging diseases, and it was clear, therefore, that Donald Trump and his administration would do the same. And lo and behold, it has happened. Now, I think, sadly, not enough attention is paid to preparedness in peacetime years. People go through these cycles of panic and neglect where a crisis hits, everyone freaks out, and the minute it's over, attention and resources start to dwindle. And that's exactly what we saw over the last several years. We're even seeing it now in the middle of this outbreak, where the pandemic isn't even over, and already people are lapsing into neglect and fatalism, and the sense that, and it's not helped by the fact that people in the White House, in positions of power, continue to downplay the future threats of the pandemic, continue to talk about it in the past tense.
Right.
And they are exacerbating this panic and neglect cycle, even though the panic phase is not yet over.
You've written a lot about COVID long haulers. Can you give us a sense of what they're going through, and do you have an idea what the effects of the virus will be, say, in 2 or 5 or even 10 years down the line?
So several people, I think I would say about tens of thousands of people, probably more, have been experiencing symptoms of COVID-19 for many months now. These symptoms vary. They come in erratic but unrelenting waves. They're usually not severe enough to send people to the hospital, but they are severe enough to severely debilitate their lives. They range from gasping for breath, erratic heartbeats, extreme fatigue that gets worse after even mild amounts of physical or mental activity, neurological symptoms like brain fog and short-term memory loss. A lot of these folks are still got sick in March, in the earliest phases of the pandemic in the US, and are still sick now. And because they are so different from this caricature of COVID-19, which is that you either are very sick and go to hospital or are mild and recover after a couple of weeks, they have struggled to get recognition, to get support, to get treatments, and now to get things like disability benefits or compensation or allowances from their employers. And I think this is going to be a huge problem. Some of them have recovered, some of them will recover, but I think that a certain proportion of them will progress to long-term disabilities, as many people who have experienced post-viral illnesses like ME or dysautonomia.
Yeah.
Will have long experience. And I think this is an aspect to the pandemic that we need to keep an eye on, because it is entirely plausible that, in the coming months and years, rather than just looking at the pandemic's toll in terms of deaths, we also need to start thinking about disabilities, people who have long-term problems as a result of their encounters with COVID-19, that are going to continue, perhaps even after we deem the pandemic itself to be over.
Do you, Ed, foresee a strong resistance to the vaccine when it comes?
I think that it all depends on how it's rolled out. I
Right.
think everyone wants a vaccine. I think there is widespread and legitimate concern now that the process of testing and then approving a vaccine is highly politicized, with pressure from the White House. The White House has denied that it is laying on that pressure, but all signs point to it, including clear statements from Trump himself about how he wants a vaccine in time for the election. I think it is a legitimate concern. In many ways, this vaccine process has been fantastic. The early parts of the research process have gone so much faster than anyone had anticipated. And that's a testament to how far vaccinology has come as a science. But there is a risk that if political pressure exists and is allowed to distort that process at the very end, that the US could have run an incredible race and then fumble right at the finish line. And I do worry that this is going to lead to, skepticism. There is already, there is already a small but very loud amount of vaccine skepticism in the US. And I think that various opinion polls show that around a third of people would not take a vaccine if it was offered, even if free, because I think a lot of people are very concerned about the impact of politicization on this process.
A slightly personal question, Ed, if you indulge me. has reporting about this pandemic, but also writing about such dire topics for 2 or 3 years or more, had a toll on you? It must be, I mean, just hearing you talk about this in such an articulate way leaves me nearly breathless.
Yeah, it's difficult. It is challenging. I think this is the work that I am meant to be doing now, but it is not a fun topic to write about. People are very sick. Lives are being ruined. Many hundreds and thousands of lives have already been lost, and I have a reasonably comfortable situation. I am still employed. I'm not personally sick, but I know people who are, and I know people who have lost their jobs, and all of this for a situation that was to a large extent preventable and predictable is deeply tragic, and it is difficult to sustain this headspace of being consistently immersed in the news, consistently bearing witness to the tragedy that is happening, and honestly, spending every day being gaslit by everyone from a random faceless person on Twitter to often the President of the United States. So it is difficult work. I think it is very emotionally challenging work. But I think it is what is necessary right now, and I hope that it helps people.
Well, I'm reminded of the wonderful line of W.H. Auden, who said it's never pleasant to open the New York Times in the morning. And I can only imagine how hard it is for you. In closing, Ed, sadly, as a journalist, especially one writing about a contentious and unfolding story, how do you guard yourself against groupthink?
I've tried to interview a range of different people. Every time I write a new piece, I interview more. I find new people to talk to. Those people come from a range of different disciplines. They are experts in fields of sociology, of virology, of anthropology, of immunology. And I think that's all one can do as a journalist. I think we rely on our sources. We rely on our own ability to integrate across the information that we're told, to ask questions that probe into the truth of what we're hearing, that try and work out where arguments are strong, where they are weak. And this is a job that I have done for 14 years now, and that I feel I'm, I don't think anyone I don't think anyone is fully ready for a moment like this, but I do feel that I've been trained in all the right skills that are necessary to cover a story like this, and I can only hope that it pays off.
Ed, it's been a pleasure speaking with you, even if the subject is so dire. It's really been good to talk to you, and I wish you well. Stay safe. Thank you so much for the work you're doing. I certainly have learned a lot. I've learned about how everything is sort of woven together, which is one of the most important aspects I find of your work.
Well, thank you so much. I'm really glad that that aspect of it is coming through. Thank you so much for taking the time to speak to me today.
Thank
I appreciate it.
All the best. Bye-bye.
Yeah, you too. Bye.
To support this show and Dublab's progressive programming, go to dublab.com/support.